Let me say there's no way I'll get this done in 3 minutes. However, I'm sure my membership will yield their time to allow me to speak this morning. Mr. Chairman and members of the board, thank you for providing me another opportunity to appear before you and speak. While you may be tired of seeing me come before you, I am committed to do whatever it takes to get it right. You all know the union's position by now. The union believes that TriMet intentionally, unilaterally began charging the union employees for insurance coverage effective January 1. Not only is illegal, but it's just plain wrong. There's misinformation being given that needs to be addressed. TriMet's general manager, Neil McFarland, discounts TriMet's intended action by claiming that the union is exaggerating the impact that unlawfully implementations scheduled for January 1 will have on our retired members. Most of our retirees live on a fixed income. The claim that TriMet's retirees will not be affected is just plain baloney. There are currently 707 retired TriMet employees, while TriMet retirees over the age of 65 won't be charged for their health insurance coverage under TriMet's new scheduled plan January 1. Some 300 TriMet retiree members under the age of 65 will have to pay, and some will have to pay a lot of money. If you are a TriMet retiree under the age of 65 and cover a family under Regents Blue Cross Blue Shield, you will be paying $235 a month on January 1. That's from paying zero to an out-of-pocket monthly cost of $235 or $2,820 a year. Don't forget that most of these retirees are on a fixed income. But it gets even worse. For roughly 23% of our retirees under the age of 65 on TriMet disability, this will be devastating for them. And again, depending on the insurance plan that they are under, the new out-of-pocket costs on January 1 will eat up more than 1/3 of their monthly disability payment. Now, how can TriMet continue to claim that there is illegal implementation that is not going to affect our retirees? Sitting next to me is recent retirees Pat Tridico and Gary Nelson. I'd like Gary to speak briefly and let the TriMet board know just how much of an impact TriMet's unlawful implementation will have on him and his family.
I'm Gary Nelson. I worked from October 19th of 1977 to January of 2009. For 2 years prior to retiring, I took upon how much my pension would be and how I would live if I could do that and not retire. I have a 6-year-old that I am raising. Been trying to adopt him now for 6 years. He's actually my grandson, but he's actually our son. And when I left TriMet, everything was going to work out in terms of my rent, my utilities, food, raising him, which takes up a lot of time and money. And now it's come upon that I've got to pay $200 and some a month, which is really going to cut into my budget. And I'm really not sure how I'm going to be able to afford to pay for my wife at this time. She has a lot of medical problems, but however, I thought of dropping her to afford just a little boy and myself, because that's really all I could really pay with my budget, fixed income of what I had coming from my pension. I don't understand. One question I have is, why is the retirees paying $235 a month and the active employees are paying less for their family when I'm on a fixed income and they're working 8-9 hours a day, which they can afford a lot better than I can. This is going to be a great impact on my family, because I don't know where the money's going to come from. Someone has to be around, of course, to take care of the little guy, and a lot of that falls on me because of my wife's medical problems, but that's what I don't really know how I'm going to afford with the utilities and the rent being as high as they are, and everything else, and food and clothing and everything that I have to supply for the little guy. Being 6, he requires a lot of medical, and I have to have it for him. He has, he's blind in one eye, and he sees out of his left eye, which he feels he sees better than I do, but I still have to take care of that as well. And so I guess what I'm trying to say is that $235 a month is going to hurt me considerably, and I don't know where the money's going to come from to be able to pay the whole month, which I already had planned out prior to us being stuck with the medical costs of $235 a month. And I guess that's one of the questions I asked you, was you were going to find out for me why the retirees had to pay more money than the active employees. So I don't know if anybody's found that answer out. I have a lot of retirees friends who are in the same boat who don't understand that as well, why their domestic partners or their husbands who are still working are paying less for theirs and they're paying more. Maybe someday somebody can answer that question for me. Thank you.
I think we can get that answer. Yeah. We'll make sure you get an answer to that question.
I would like you, thank you, Gary. I'd like you now to hear from Pat.
Good morning, everyone. I used to teach school, so forgive me. I'm adjusted to looking at most of the audience, but I understand you're part of my family, and I'm proud to be part of it. I felt at home, whether I was driving a bus and in the bullpen at Center Street or Merlot, whether I was with some people on a holiday and not at home with my actual family. And then I knew the reason why when a lonely person would come through the door, and I could see the look in their face. They really didn't have very many people other than the bus driver to get them from point A to point B. I've included a copy of my official statement. I mailed it 2 days ago to the union office, so the copy I was going to read is now attached, but I wrote a few notes. So every word spoken today, every thought that you interpret is important. Oftentimes we let things go without paying enough attention, but this is extremely important for all of us and our family. You have the same intention that those of us who put a career in at TriMet have. It is to safely transport the public. It is also to provide jobs. And the jobs that we have together in this family are important. I taught at every junior high, every high school as a substitute teacher in Portland, Tigard, and Beaverton. I coached thousands of swimmers for Tualatin Hills Park and Rec. I'm known all over town. When we moved here 24 years ago, I thought it was a big city, moving here from Louisiana, Lake Charles. But shortly thereafter, I found out I was meeting people all over town that already knew me or I knew them. And after 24 years here, it is more of a small town and we are more of a family. The people I used to coach and teach are now young adults in the community. The parents are baby boomers like myself. I just retired at 62, 14 and a half years with TriMet. I banked in about 1,240 sick hours. I think the only days I ever called in sick, some years, I had a migraine a couple of times. I had the flu one year, knocked me out of 2 or 3 days, and all the rest of the years I had perfect attendance or only missed 1 day. So I had quite a bit of sick leave banked up. For all of my 14 and a half years and all that sick leave, I get about $40 a day from TriMet. The promise was health insurance for the family, that would be my wife and me, paid by the company, the agency, forever till we pass away. The promise was the pension that I'm getting. I put into Social Security and I also put a lot into deferred comp. Basically, I can live on what I'm getting now because I was putting a good bit away, and I don't live high on the hog. But if raising my health insurance each year as the additional cost may be incurred by the agency because of Blue Cross, Kaiser, or any other health provider increase, if they pass that along to those of us, and the workers are wonderful people who, out of thousands of them, only one or two here and there make a grave mistake. There may be others who make minor mistakes, but they're all wonderful people, and we all have the same intention. That is to serve the public and get them from A to B safely and in a happy manner, a friendly manner. So for the work that they do and for the morale of the troops out here, please don't pass along annual additional health insurance cost to the workers and retirees. I can imagine if, like in my case, for just the two of us, it's going up for Kaiser $40-something a month. Well, we can afford that right now, but if you did that every year, 20 years from now, well, there's not much left of my retirement. So please don't do that.
Thank you, Pat. Let me address this all too common reply that we get from General Manager McFarland, that the law lets us do it. The law lets TriMet do it only because their attorneys are telling them that. But help us all understand these undisputed facts. Under the tenure of both Tom Walsh and Fred Hansen, which covers the past 15 years or so, both honored the terms of the collective bargaining agreement for months and sometimes more than a year until the new agreement was in place. And even after the new arbitration law took effect, Fred Hansen continued to acknowledge TriMet's obligation to continue all terms of the existing contract by agreeing to negotiate wage increases on December 1, 2009, and again picking up all cost of health insurance premiums increases on January 1, 2010, and then wrote about it on TriMet's websites. Here's another problem you have. The union has already been notified that some of our members will have to pay for insurance that they are unilaterally implementing on January 1, and that they won't have health insurance anymore because they're not going to be able to pay for it. In fact, I have a letter today that I'll only read just a brief statement that I received yesterday from one of our retiree spouses. My husband worked from TriMet from 1993 until January of 2010, at which time he had multiple strokes and was forced to retire because he was unable to hold a CDL or drive. His current monthly pension at TriMet is $818.39 a month. They're currently paying $206, $2,470 a year, premium to cover their health insurance, which leaves them currently $605 a month in their pension benefits. When they received their open enrollment packet for 2011, they called TriMet's benefit office to inquire the rate quotes were for mini-run operators. They were told since only a handful of retired mini-run operators that TriMet decided to charge the retirees, mini-run operators, the same rate as full-time operators. For her and her husband to stay on the same plan, they were quoted $195, which they were more than happy to pay because they had budgeted. On November 9th, 2010, they received a correction in their open enrollment, stating that the rates for retired mini-run operators to cover their spouse will be $348.78. This rate was also the same for the MROs retiring with children and families. So whether you're insured by 2 or 10 dependents, they will pay the same. The new premium rate of $348.78